Dear Chair, dear audience, the title of my research is the effects of different additional therapies in cerebral palsy. My name is Márk Pulay, and I have graduated many years ago in the András Pető Faculty as a conductor. And my vision is that Pető method contributes to better quality of life of patients with cerebral palsy. And therefore, my mission is to find and implement new cutting-edge technologies and additional therapies which fit to the holistical approach of the Pető method. To reach our aim, we set up few projects and goals. The first one is the meta-analysis, and I'm going to the details. A meta-analysis about an additional therapy called whole body vibration. But let's talk a little bit about the background, especially about the patient population. Cerebral palsy is caused by mostly perinatal noxa and characterized by abnormal tone, posture, and movement. Maybe this is the most significant symptom, is the abdominant tone, such as hemiplegia or tetraparesis. We say that patients with cerebral palsy require lifelong therapy, conventional therapy, physiotherapy, or in Hungary we can say conductive education is also a kind of conventional therapy for this patient population. But many additional therapies are available. And one of these promising treatment is the whole body vibration. As you can see on this figure, this vibration platform can be used in different settings. Our aim is to collect and evaluate the RCTs available in this topic, in this intervention, especially on musculoskeletal system in patients with cerebral palsy. Therefore, the PICO looks like this, and as I explained, the primary outcome is changing in musculoskeletal system. We conduct a systematic search in the most frequent databases, and finally we got 16 eligible full text for analysis. And this is, I'm just going to show you a few examples from my results. The first one, it's gait-related results. It's a walking speed. The second one is also gait-related, so this is why I put this together. And the first one is measured with centimeter per secundum, and the difference of mean differences, it's more than 10.3. And this is not just clinically, but also statistically significant changes, and in the other case as well. But of course, these two parameters is very strongly related to each other. The second one, which is very important, as I told, the most significant symptom is the spasticity in the CP population. This forest plot shows the difference of the mean differences in changing of spasticity, which was measured with the kind of gold standard ASFORS scale between the intervention and control group. We could only involve 3 studies. ASFORS scale, it means 0, or 0 means that no increase in muscle tone. So therefore, the favors of intervention in the negative part of the plot. And we can see positive changes, but statistically not significant. But clinically, I think it's important if we, from the score from 0 to 5, if we change more than 1 point or decreased more than 1 in the spasticity score. The other one is also a test. It's called gross motor function measure. It contains 5 different domains. And here we can see 2 domains, the D domain, which is the standing domain, and the E, which is the walking. It's also a dynamic parameter. The test authors reported that more than 1.3 point changes in the test, it's clinically relevant changes or improvement, and more than 3.7 is already between great or moderate improvement. To summarize the results or also the conclusion of this study, that there is a clear tendency to have beneficial effects on musculoskeletal outcomes, especially on gait parameters. More RCTs with longer-term follow-up are needed, definitely. And due to the wide range of vibration configurations, so different duration and intensities, we propose to define the guidelines and the strategy for this intervention. Actually, I already sent some press submission inquiry. I am in the conversation in the targeted journal, which is the Developmental Medicine and Child Neurology. The second project is another additional treatment called pulse electromagnetic field therapy. As I already told, that there are many conventional therapies, and this additional therapy has already convincing experience in disorders with abnormal muscle tone, such as sclerosis multiplex or Duchenne muscular dystrophy. But however, there is no evidence of this therapeutic approach in the CP population. So this is why we aim to assess the beneficial effects of this additional treatment on symptoms associated with cerebral palsy. The PICO looks quite similar as in the meta-analysis. This is a pre-study protocol, so we are just in the protocol and actually in the drafting phase. But our question is that this additional therapy improve overall stability, muscle strength, and spasticity as well. And I'm going to the details about the protocol drafting. We, of course, set up many inclusion and some inclusion and many exclusion criteria, such as a patient with epilepsy or shunt. And the methods, the design, we designed a single-centered, double-blind, placebo-controlled, and probably a crossover randomized control trial. Here you can also see the intervention, the used or the planned intensity and frequency. And the placebo or sham group will get the same condition. So this pillow will be placed on the lap of the participants. They can also place their hands on this pillow. And in the case of sham device, the device will switch off, because this device has no voice or vibration, so the participants cannot feel that this is on or off. Last year, we conducted a pilot study. We involved 12 participants, so it's good because it's helping us in the sample size calculation as well. But most importantly, we could try the dosing, the intensity and frequency of this device. There was no side effects, so we can say that this is safe to use. Maybe we will increase also the intensity and the frequency of the intervention. And we are talking about patients with cerebral palsy, so therefore the body positioning it's not always easy, especially in those clients or patients who are in the higher or more severe CP cases. And finally, we also collect the measurement techniques, which you can list it here. We tried some of them in the pilot study. So this is the progress of this pre-study protocol. And here you can see the 3 projects. We don't know, I cannot plan that when we'll start this RCT, hopefully next year. So I would like to thank you for your attention and finish my presentation with this quote: "Between stimulus and response, there is a space. In that space, our power to choose our response. In our response lies our growth and our freedom." And thank you again.
during the systematic review, did you capture any difference between the whole body vibration and the severity of the CP? Like you mentioned, the gross motor function measurement, so the severity of the CP.
Yes, thank you for the question. Yes, this is somehow not the limitation, but the challenging of in most CP interventions or RCTs that there is different severities of CP. My experience was that in those CP patients who are in less severe, they can improve better with this device than those who have a higher number in the CP classification, so more severe cases. So this is only my experience, but I cannot say the exact answer for this because of the number of the RCTs. So if we have more RCTs, maybe I can give you more exact answer for this question.
The methodology, you said it's double blind, but who is switching on the pillow or who is switching it off? Who is checking that part?
Yes. Of course, we will involve the team who is participating as a managing team, and those colleagues who are involved to controlling the device, they have no connection with the patient. So actually, they are out of the institute. So they are coming out, and this is how we can guarantee this.
So they come in just for the purpose of switching on the pillow?
Yes, for the intervention, but the children, they don't know them. So, and maybe also the crossover design, it's helping because everybody knows that once they will get the intervention.
Are there any risk or side effect of the whole body vibration, so the vibration therapy? Are there any patients that shouldn't use that therapy, or all the patients can use it?
There was just in few cases there was some reported cases when there was some side effects, but the eligibility and the exclusion criteria was always well developed, and this is why maybe the reason that there was no serious side effect.
I could see that there was a great heterogeneity among your meta-analysis, and why do you think is that?
Yes, thank you for the question. This is somehow related to Adrian's questions that there is a big differences in the severality of the CP. So, and this is one of the main reasons behind the heterogeneity, I think.